Week's edition of Northwest Newsweek. I'm Riley McManus. Tragedy struck Friday morning on the Sandy Lake First Nation following a house fire that has claimed the lives of 3 children. Sandy Lake is located about 600 kilometers north of Thunder Bay. The chief says the community is devastated and that the children range in ages from about 4 to 9 years old. The mother and 3 other children escaped while the father was at work. Investigators, relief police officers, and 2 coroners arrived in the community late Friday. Anishinaabe Nation Deputy Grand Chief Bobby Narcisse is offering condolences to Sandy Lake and thanking first responders for braving the extreme cold at the fire scene. There appears to be differing realities between those asking for and providing military supports for Bearskin Lake, which is contending with an outbreak of COVID-19 that crippled the community and made national headlines. There's also discussion as to how to address the recovery for the community, which fortunately has seen a reduction in the numbers of active cases. Adam Riley reports.
The boots of Canadian Armed Forces personnel have hit the ground in Bearskin Lake First Nation, a community that has been devastated by an outbreak of COVID-19. A release from the Ministry of National Defence indicates a total of 10 Canadian Rangers have been activated, some of whom were already in the community in isolation. Last week, there were outcries as to what was taking the military so long. Indigenous Services Minister Patty Hajdu says there is a protocol around bringing in the armed forces for support that required an official request, not in the form of a press release or public statement.
It can create confusion, and it's not necessarily the best way to plan from the military's perspective on how to use limited resources in a time where all of the country is under surge.
But despite word that military personnel had arrived, community members have taken to social media countering that narrative. One stating, "Hello Houston, we have a problem. There is no military or rangers here." A release from the Anishinaabe Nation speaking on behalf of Chief Lefty Cometa Wadaman, who has since tested positive for the virus, says as of Wednesday, only 3 rangers had arrived and 2 of the 4 rangers from the community were unconfirmed and potentially still in isolation. Cometa Wadaman says he is frustrated with the response. On Thursday, while providing an update to media, Hajdu says she has spoken with the chief to try to address those frustrations.
Today, he mentioned additional gaps and some potential vehicle needs. So, I've raised that with the deputy minister already to try and figure out what those gaps are and what those vehicles are needed.
Hajdu says a large contingent of support in the form of medical personnel paid for through her ministry have arrived to assist the community. Meanwhile, the MP for the Kenora riding, which includes Bearskin Lake, says while it's great the federal government has responded to the emergency, a long-term approach needs to be discussed. Eric Melillo notes many of the conditions, such as limited housing and medical infrastructure, allowed the virus to spread so rapidly in the community. He hopes that as this crisis is addressed, there are resources put in place to prevent a similar situation in the future.
Any support, any logistical support that the government can give to help keep that continuous and ensure that the community has the coverage is going to go a long way. But obviously, looking forward, there's a number of concerns in the sort of the medium and longer term of the support and the resources that this community needs, and many across the north need to be better equipped for the potential of future situations such as this.
As of Thursday, the number of active cases in the community has drastically dropped to 47. Adam Riley, TBT News.
A shocking video which appears to show Kenora OPP officers engaged in a downtown shootout is in fact a fake. The 30-second video was posted on social media Monday night and then removed about an hour after its posting. It showed what appeared to be police firing their guns outside a gas station on Chipman Street. Some people online began to notice that some things in the video just didn't add up. Constable Jason Canfield says officers did respond to a call in that area that night, as seen in the video, but the audio was not real, as no firearms were discharged. Canfield says they received numerous calls from panicked residents about the video. A police investigation is now underway and charges of mischief could be laid.
It did alarm a lot of people, and a lot of people did believe that this was real. It was put up in order to mislead people. Like, you wouldn't put something like this up if you weren't thinking that someone's going to think it's real. There is an investigation right now regarding this and trying to put a stop to things like this in the future.
Kenora OPP do have names of potential suspects, and while social media profiles can be difficult to track, there are resources from social media companies that will assist police. The COVID-19 situation in Thunder Bay is only expected to get worse, according to the district's medical officer of health. Dr. Janet DeMille is expecting a peak by the end of the month. The health unit will soon ramp up vaccination clinics to counter the spread, with the focus on the youngest eligible population. Corey Nordstrom reports.
We have a lot of COVID-19 in Thunder Bay. We have more right now than we did at any other point in time in the pandemic.
Though it's now harder to get an accurate reading on active case numbers, DeMille is confident local cases are still rising daily. The Thunder Bay District is also reportedly seeing more outbreaks and higher rates of hospitalization than some of the worst times since the pandemic started. And the medical officer of health is expecting things to worsen over the coming weeks.
I'm hoping that we will peak sometime in January, maybe by the end of January or at least early February, and then we'll start to recover with less outbreaks, lower numbers overall, but it will take another, 4 to 6 weeks to sort of recover for that.
In efforts to control the spread of the virus, more vaccine clinics at the CLE's Heritage Building will run from the 21st until February 11th, a main focus being the 5 to 11 age group. Just 50% of those children are vaccinated against COVID-19 at this point, and DeMille is hoping more will get the shot after the group saw just a 1.6 increase in uptake last week.
It sort of slowed down and as we approached 50, and now I think there was a little bit of an uptick recently, but certainly that does suggest that a lot of parents are out there that haven't chosen to get their kids immunized.
And by getting children in the youngest eligible range vaccinated, they're protecting the rest of the family, including those under 5.
One of the age groups that I'm particularly concerned about is those individuals 0 to 4 who aren't eligible for immunization. And I know that many kids 5 to 11 may have siblings who are not eligible to be vaccinated.
DeMille says it's best that kids get back to the classroom, though she knows there will be complications and warns that canceled classes and school closures are a possibility. The Lakehead Board has announced that canceled classes will be treated similarly to snow days, with notifications on the school's social media the night prior or the morning of a cancellation. Corey Nordstrom, TVT News.
The area's child care centers are about to get the same resources as elementary and high schools to prevent the spread of COVID-19. The Thunder Bay DSAB is expecting to receive a shipment of rapid antigen tests and personal protective equipment for licensed daycare workers around the district. This comes after the province's recent announcement that child care staff will receive priority status over the vaccine as well. DSAB Director of Integrated Social Services, Ken Ranta, believes that this distribution adds another layer of protection.
We have 45 licensed child care centers, and that's all throughout the district of Thunder Bay. So all of them were eligible to receive the test kits. They're also eligible to receive direct deliveries of enhanced personal protective equipment, N95 masks and other gloves, shields, and other materials as well.
The DSAB has contacted child care services in the district to let them know the COVID-19 tests and PPE will be delivered soon. It is unclear exactly when the shipment will be arriving, but as Ranta says, the province mentioned sometime later this month. The hospital in Fort Frances is contending with an outbreak of COVID-19. Following the arrival of the virus into the facility last Saturday, it comes at the same time as another facility in the Rainy River District battles another respiratory outbreak. Adam Riley has more.
We've really been pretty aggressive in our measures, to be honest. But again, the variant has entered our facility.
On January 8th, the La Vérendrye Hospital announced it had a suspected outbreak of COVID-19, with one patient testing positive for the virus after they had been admitted into the hospital.
Were we able to track where it came from? We were not able to. But according to the standards, 2 cases would then implement that you would be in a COVID-19 outbreak if in an acute care setting, which is the case.
By Thursday, Loveday says that outbreak had grown to 5 cases, with both patients and staff affected in the hospital's inpatient unit, which houses surgical, obstetrics, pediatrics, and the ICU. Fortunately, the outbreak appears to have been contained, and while some staffing issues have arisen, it hasn't required the hospital to recall staff off sick. Loveday wants to assure the public that they can still receive care at the hospital despite the outbreak.
Don't be afraid because we're in an outbreak. We have very strict isolation and infection control practices. We've ramped up high-touch cleaning. We're doing everything we possibly can. Of course, if you don't need to come to the emergency department, probably not a good idea to come. However, if you do need medical care, you need to come.
Loveday says while it is unfortunate they're having to contend with the situation, she is happy it's the only COVID outbreak, as an outbreak announced at another Riverside facility is non-COVID related. On January 9th, a respiratory outbreak was declared at the Rainy River Health Centre. As a precautionary measure, all those with symptoms were tested for COVID, and all tests have come back negative. Loveday says, like a similar respiratory outbreak at Rainy Crest Long-Term Care late last year, precautions are taken to prevent interfacility and interdepartment staffing.
So because of that, so a staff member may work here at La Vérendrye Hospital, but they also work at Rainy Crest or they work at EMO because Riverside is multi-site. So because of that, we've cohorted staff. They can only work at one site.
As to when the outbreak at La Vérendrye will be declared over is still up in the air. As Loveday says, it takes 14 days from the last known positive case. Adam Riley, TBT News.
Minister of Indigenous Affairs Greg Rickford has provided an update on the $10 million commitment the province made last summer to search for burial sites at the former residential schools in Ontario. Rickford announced the funding at an event in Kenora back in June. Since then, he says his ministry has been working with the Indigenous-led groups to support some projects, most notably the Washajushkanigan First Nation near Kenora. There are also several active applications being considered by the Indigenous groups. Rickford says the communities themselves have taken up the responsibility of helping to organize certain activities, as the situation is more complex than meets the eye.
Our responsibility is to make sure they have the tools to do them. And that's why, in addition to the resources that our government committed and I announced on 2 different places in the last calendar year, some of my other colleagues have come along with additional supports, which I think can help the Indigenous-led group focus on specific recovery and reclamation activities.
Rickford says as soon as they are able to identify other resources, more of the allocated budget can be used to search the 18 former school sites. When we come back, the source of the leak of a confidential information in Fort Frances is revealed and apologized for.